Ladies, you are not alone. What kind of treatment do you usually recommend? Where do you start?
So Ed, that's a great question. And we need to start with the questionnaire to find out and specify what issues we're having. Then the combination therapy is what seems to work best in these cases. And that combination is family support, therapy with a trained postpartum specialist, psychologist, as well as medications at some points. Absolutely.
Now, I want to make sure we talk about the psychologist here, because that's a very important part of this. Because as someone is going through this, you need to not only identify what they're feeling, but isn't it fair that you've got to start working on it right away? I mean, you have a critical issue here, which is stopping someone from living their life. So you've got to dig in as hard as you can right away.
Absolutely. You have to get them to a therapist within a day or two, if not more. Sometimes we've had patients, we keep an eye on them. We keep calling them to make sure they have an appointment with a trained psychologist. We make sure sometimes they need to start 2 to 3 times a week meeting with this person and then take it from that point. And then we are in communication with the psychologist to assure that the patient is being compliant, is going to their appointments, and is getting the help they need.
What about medications?
Yeah, that's a good question. A lot of patients are concerned. They're worried about taking medications. They don't want to be on something for the rest of their lives, and that's a misnomer. That's not the case at all. We use medications that are safe in both pregnancy as well as the postpartum period, and they're used at a low dose for a short while. And the patient will be able to tell you after they've done the therapy and taken the medication when they feel they don't need it anymore, and we can taper them off at that point.